One. We're live. Live with Dr. Sharma. This is round three?
I think this is four.
Round four. Round
Yeah.
four. I know we've done a couple of these,
hmm
and I was looking forward to this. In fact, on my last podcast, I was talking about how excited I was to have you on here. So, a couple of things that we're going to cover sounds like are going to be, well, I know the mask thing's going to be a big one for those of you that are listening. I understand, and it sounds like we're going to be talking about that. Hopefully, it's a rainy day out today. I don't know if the mics are going to pick up the rain or not, but hopefully it won't be too bad. But yeah, so I'll let you jump into it. We got a couple of things up here. Let's talk about masks. Can we do that?
I want to start actually just by putting things into perspective.
Mm-hmm.
And I'm not doing this to scare people, right? These numbers are out there. I think we all just get a little numb to this after a while because it's been going on so long and
Mm-hmm.
I feel it. But I I would remind everybody that we're still in a public health emergency. And this isn't just because I say it,
Right.
right? I would say, well, it's the CDC, it's the state of Indiana, it's the World Health Organization. This is a true global pandemic that's been devastating for a lot of individuals and families across the world. Um, One of the things that I know, some people pay attention to the numbers in terms of the number of cases and other things. I'm just gonna sort of hit on the number of deaths, so we can remember that this is real. So in the United States, we know that I think yesterday we crossed the 150,000 death threshold, and that's a lot. You can put it in perspective of different wars if you want to. I'm going to put it in perspective of local populations. So 150,000 deaths in the United States over less than 6 months. So about, 4 to 5 months. That's basically the population of Warren County, the population of Fountain County, the population of Vermilion, Park, Jasper, Montgomery, and Newton all together.
Wow.
It'd be like every single person in those counties is dead. And that I think puts some perspective to say, well, these are real lives that are being lost.
Mm-hmm.
And um and yes, they're being lost in the United States. And this is something that we can still do something about. Um, it can be true that these deaths are being lost to COVID 19, and we can successfully get back in schools. We can successfully address this from a public health point of view appropriately. But we've got to remember that this is a real thing. For example, well, for the last several months, that's been about 150 days, near 1,000 deaths a day, right? If we had three airplane crashes, 2 to 3 747s going down in the United States every day, with everybody on board dying, we'd probably be like, "What is going on?"
Ain't flying these no more.
Right?
Yeah.
And we would make a significant response, and we have made significant efforts with COVID-19, but I would say we would consider that intolerable. I would say that this is intolerable the way it's happening. And we need strong leadership. We need strong messaging, and we need understanding to not lose perspective on this, because I get it. It's tiring. We all want it to be over, but it's not over. And wanting it to be over isn't going to make it happen.
That makes sense. So are you particularly talking about like the people that just I'm done with this shit. I'm doing my thing.
Yeah.
Yeah,
And
cuz
I think I said at the last one is it's not about you,
right.
right? I don't care who you are.
Mm-hmm.
It's not about you. It's about your neighbor. It's about your mom, your grandma, your kid.
Mm-hmm.
Um, and yeah, you can say that, your freedoms are being impinged upon. Fine, but it's not about you,
Mm-hmm.
right? It's about the country, the community, Warren County. It's about businesses. It's about everything. And so, I don't care if you don't want to wear a mask,
Mm-hmm.
right? You don't have to wear a mask in your own home.
Mm-hmm.
You're outside, you don't have to wear a mask.
Mm-hmm.
You go to a public place, you're exposing someone else, you should wear a mask.
Yeah.
And yeah, it's me saying that. Am I going to come out and put a mask on you? No. But do you have some individual responsibility? Yes.
Hmm.
And does it make a difference? Yes. Is it too much to ask of you? No, it's not. And if you think it does, then remember, it's not about you.
Hmm. One thing I did want to ask as well is, so originally when we talked, and I know, like I understand that things change, and so I guess I'm just trying to get at what had changed. But originally we were team no mask,
You're
right?
right.
So you didn't want to be fiddling with it and shit like
Correct.
that. You know, you're gonna get it on your hands or whatever. What has particularly changed to where we went the other
Yeah.
direction on that?
So, and again, I think we need to remember you and I did two Facebook Live or podcasts
Mm-hmm.
where we had basically shared that message that masks need to be preserved for healthcare workers.
Mm-hmm.
Masks were in limited supply, and the evidence wasn't in about how much difference masking made for the general public in terms of spread.
Okay.
Now, our last podcast, which was probably 2 months ago,
Yeah.
we changed that because I can't remember the exact date, but I think it was probably late March or early April when the evidence was more clear to say, hey, masking makes a big difference. So it took us about 30 days
Mm-hmm.
to really figure that out. Um, However, we were still in a different situation than when masking was of limited supply. So I would still say that the public probably shouldn't be wearing N95 masks. Those are, probably should be reserved for medical workers in high risk situations. The public, if they can get a surgical mask or a procedure
Are those like
mask,
the blue ones?
yep,
Okay.
then it's okay for them to wear them. But probably for the general public, cloth masking is the way to go. And those sewing patterns have been on the CDC website for months now, and I get it that consistency of messaging is important, and there probably was a period for the first month of the pandemic when lots of things were going on, when resources were limited, when we suggested that the public should not wear masks because the evidence wasn't clear for it. But that's 30 days out of again probably close to 5 months, and it's been consistent messaging since then. So changing your mind based on science and
Mm-hmm.
evidence is not inconsistent. It's the way
It's
science
learning,
works,
right?
right? And
Yeah.
it's the way we all should function.
Yeah. One question I have about the mask too, in particular, is people often, I guess, try to figure out how well they work, and I've seen people get like cheapo masks that you can blow out a lighter with. Like, I don't know if you've seen
Yeah.
any of these things. Is the mask necessarily to prevent the air, or is it more of like the droplets that come out of your mouth?
So, masking, the initial evidence was to suggest that masking um, prevents you from spreading disease to someone else if you're asymptomatic. So, my mask protects you.
Right.
There is growing evidence that your mask also protects me. So, it's both ways.
Mm-hmm.
And yes, masking interrupts the droplets or particles of the virus that may come from your air or your breath or someone else's breath. So they potentially get caught on your mask, or they don't go as far away from your body.
Right.
And then they land on other surfaces.
Mm-hmm.
So, and it doesn't mean that surfaces are completely without risk, but we do think that most of the transmission of this virus is airborne or, droplets from respiratory issues.
Uh-huh. One thing I saw too that, and the information changes all the time, but it was from a reputable source, and I can't remember where it was now. But I did read it, and I don't think it was the CDC, but it was on a healthcare website. But they were saying that within I want to say like 3 to 4 hours of it being like the actual COVID-19 on a surface when exposed to UV light, is pretty much gone.
Oh yeah, I would agree with that, right? So UV is effective. We're not going to put it inside our bodies,
Right.
right? When it's not going to do squat once we get it already. But we know that UV light is can damage lots of things, even
Hmm.
our own skin cells,
Right.
right? So but yeah, and so we think that you know, say if you had a kid in a classroom, right, that or if you have a whole classroom that's infected, well, then if you just leave that classroom completely alone for 24 hours, probably you can safely go in there and clean it,
Hmm.
but it's really low risk after
Right.
24 hours, even without UV light.
Oh.
But UV light probably speeds that process up. Probably, well, it likely degrades the virus faster, but even just time
Hmm.
on a surface is probably sufficient. So 24 hours for most surfaces is likely sufficient.
Yeah.
So if you have exposure or someone's sick in a room and for whatever reason that you need to decontaminate that room, just let it sit for a day and then go and clean it appropriately.
That makes sense. So would you say that it's less harmful, or maybe you'd be less susceptible outside during the daytime versus
Yeah.
at night?
Um
I've heard people
so
talk
I
about that, and
so yeah, no, I would say that probably outside without a doubt is safer in terms of disease spread.
hmm.
And but that's more based on air circulation than UV light,
Gotcha.
right?
Wind
So
blows it
it's
around, whatever.
yeah,
Right.
it's more that well, you just have more area for your viral particles if you're shedding them without knowing, or someone shedding them with knowing.
Uh-huh.
If you're sick outside or spreading outside, that it's just a larger air mass, that it would be less likely for a sufficient amount of viral particles to go to the person next to you or that you're talking to. And masks cut that down even more.
Right.
Um, Now, I am going to sort of add a little bit because there are questions. Well, is a face shield as good as a mask? There's strong scientific evidence to say no, it's not. I'm not going to point you to the article because people will read it and then come up with their own opinions about it anyways. If you want to take my word for it, and take my word that there is strong evidence that it's not that face shields don't do anything. They do something, but they probably decrease your risk about 20% if masks were 100%. Now masks aren't 100%, but part of the protection is from potentially a face shield, and part of the protection is from a mask. Now, whenever I go in to see any patient, any patient with face-to-face contact, even if they're not sick, they're coming in because they stubbed their toe.
Right.
I have to wear a level 2 or 3 surgical face mask. I have to wear a face shield, and I sanitize going in and I sanitize coming out.
Damn.
And so that's standard of care. That should be the same for anybody practicing medicine, anybody giving direct patient care, and that protects me. It also protects them.
Right.
And uh, now we're not saying you need to wear a face shield. Face shields are uncomfortable, inconvenient. They fog up. I get it. But if you're a clinical worker, then we encourage you to wear a face shield if you're in direct patient contact. So if you're a first responder, if you're on an ambulance, if you're going in that room with a patient, or you're going to be in the back of an ambulance or in their home, put both on. And we think that that level of protection, um, you know, in general, will help to keep, our medical infrastructure intact. They need to have higher level of protection if they're doing aerosol producing procedures, which we won't get into that here today, but that guidance should be out there for, medical staff.
Yeah. The one thing that I will say that's very frustrating, that like when I was at the airport, so about a month ago now, I was out west and traveling, and at that time, it was mandatory that you had to wear a mask to get on the plane and that kind of thing, which is fine. But what was a real bummer is that I would say even the people at the airport, I would say 80 or 90%, like next to very little had like the mask on over their nose. Like
Yeah.
everyone was just like half-assing it. And I don't think that I think that if you're gonna half-ass it, and I'm not a professional, I'm a dummy, so you don't take this for what it's worth. But if you're
Yeah.
gonna half-ass it, don't do it. Uh,
Well, um, I would encourage people to try to do it correctly.
mhm.
And you hit on this earlier, but not all face masks are made equally. We would recommend that if you have a face mask, it be at least 2 layers. Just this is still available for all the public pretty much anywhere. If you want a face mask that's been made, that it's good quality, we have them at the health department. If you want them for your staff, you want them for your employees, you can get them at the health department. We are asking a $5 donation for the mask. If you wanted 100 masks, come and get them. If you want 2 masks, if you can't pay for it, we'll give them to you. The money that we get for masks, it's certainly not going in my pocket. It's not even going directly um, back to, per se, the county coffers. What it's doing is going to make more masks. And we have probably 2 to 3 thousand masks, and I would say thank you to all those wonderful assistants, not only people who cut fabric, but people who have spent endless hours sewing and helping us. That labor is precious, and the quality of what they've done is excellent, and it's helped us in our efforts.
Yeah. Well, so I guess kind of on to the next thing. What about like the enforcement of it? How do you?
Yeah.
I mean, how do you want to get into that?
Yeah, so here's I think this takes a community. This takes um, education, and it takes leadership. I get it. If you're a small business owner and someone's coming in your office, are you taking some risk to your business by pissing someone off and saying, I think you should wear a mask if you come in here or you need to leave?
Mm-hmm.
Well, absolutely.
Right.
I'm going to go on the other side too and say, are you taking some risk by not?
Mm-hmm.
Right?
Yep.
And I think that answer is yes. Are there people who would patronize your store or come in and be better protected if you enforced masking? Now, there's a right way to do it and a wrong way to do it. I think we need to be supportive. We need to recognize that that some people get rubbed the wrong way with the concepts of masks. If you're a business owner and you want, 20 or 30 disposable masks that you could hand out to people who come in without masks, come to the health department and ask us, right? We'll be able to distribute those supplies to you because we think it's important. Do you need signs? Should you put signs on your front door? I think yes. If they know when they come in, then it helps. Then they couldn't have missed it, right?
Right.
We have signs. I know we sent out this on our email list the other day. It's all gotten crumpled in the rain and everything, but it's a brochure on COVID-19 signage, and it has all of the signs that are available from the health department. If you want thousands,
Did you guys mail these out?
we did not mail them out, but we did send them out to people who have signed up on our email list. So that's through our website.
Because I got one of those.
Yep, it's through our website, and then there's an order form on the back, and there's signs that have some fun with it, right? If you want one with, say, keep a cow's length apart, you can have one. If you want one,
You can leave that here if you want. You can post that
right.
back, or I'll take care of it.
And I think that it's so signage, awareness, consistent messaging with your employees, and you as a leader doing the right thing. Now, that's not to say if you're in your individual office that's not considered a public space, then you don't have to wear a mask. That's not necessarily covered under the governor's order, nor is it covered under the guidance that's been issued by the Fountain and Warren County Health Department. If you're in your home, you don't have to wear a mask. It's your choice.
Mhm.
Some people may choose to wear a mask in their home at times if they have someone who's sick and they're living with someone else who's high risk, right?
Right.
Well, that sounds logical to me that they
Yeah.
can try to distance and they may wear a mask in their home. Um, but uh, but but my feeling is that it's about education and support. Um, and I know that the sheriff's not going to arrest you. You're not going to get a fine. Um, could you get a lawsuit if someone's exposed because you ignored public health rules or recommendations or the governor's order? You're going to have to ask an attorney for that.
Right.
But we shouldn't do it because of fear of liability. We should do it because it's the right thing.
Yeah, that's what's kind of happening in such an odd time that we're in. Is it seems like everybody is at everyone's throat about whatever they can find, and whether you wear a mask or don't wear a mask. Like, I mean, is that worth damaging relationships over? Like, I mean, I don't see it that way. I wish
Right.
that it's heartbreaking to see communities distance themselves from others,
Yeah.
based on just different opinions or different views or whatever. And it's a real shame, whether it's politics or this shit or
Yeah.
whatever. It's like, man, come
Right.
on, like, just be team players here.
And I completely agree. Right. I don't think we're on different sides of this issue. Right.
Right.
We all we all probably want COVID-19 to be over.
Yep.
We all want businesses to stay open.
Mm-hmm.
We all want schools to educate our children and do it in an effective way. And I think most of us really think that that's going to be most effective in person. Um, we all want to be able to go on vacation and socialize and hang out with other people. We all want the same thing. We're all facing the same challenge, which is COVID-19. Um, and I think that if we address it cohesively as a group, then we'll be able to get to a better solution quicker. And uh, so my feeling is that pro public health is pro business,
Right.
pro public health is pro economy, pro public health is pro education, pro schools. It's it and if things move in the wrong direction and say we need to shut down businesses, we need to quarantine a class, we need to quarantine a band or an athletic team, well, it's not because we don't want people to play sports. It's because we realize that the health response in that situation outweighs the importance of playing in a band
Right.
for 14 days.
Right. Yeah. And so I guess what would you say to the people that think this isn't a big deal? That think this is, it's less deadly than what we had originally thought, which I think that's true.
Yeah.
Is it?
Well, I think initial estimates were that the death rates were somewhere between 2 and 3%. I do think that they're probably closer to 1%, maybe a little bit more, a little less. The death rate for COVID-19 obviously depends on where you live, what resources you have, how old you are, and other things. So
Mm-hmm.
these percentages can be manipulated by whoever wants to manipulate them one way or another.
Mm-hmm.
But we still know that 150,000 people have died.
Right.
And for those of you who think that this isn't a big deal, well, I'm glad for your lighthearted view of this. And I think that maybe you're sleeping better at night than I am. Um, but at the same time, it will matter once it matters to you.
Yes.
Right?
Yeah.
And, I had someone on a local school board ask the other day, and they didn't ask like in an accusational way, but it was an ask to say, well, how many kids less than 18 or under in the state of Indiana have been infected with COVID-19. I didn't actually have those numbers right at the top of my head, but I
Uh-huh.
do now, right? Because I looked.
Yeah.
And it's about, at that time, it was around 4,700, so 4,700. And then they also asked have we had individuals in that age group in the Bi-County area be infected with COVID-19? And that answer is yes.
Mm-hmm.
I'm not going to give you specific numbers because they're pretty small.
Yeah.
And then the other corollary to that is to say, well, how many deaths have we had in that age group? Fortunately, none in the Bi-County area. We'd like to keep it that way forever. At least certainly we can, hopefully, in that younger age group. But in the state of Indiana, I just ran the numbers before I got here. We've had 3 deaths that are attributed to COVID-19 for ages 18 and under. We've had 9 deaths for ages 20 to 29. We've had 18 deaths for ages 30 to 39.
And this is in the Bi-County?
No, this is in the state of Indiana.
Oh, okay, all right.
Yep.
Okay.
So in the Bi-County area, we've had a limited number of deaths. So I think 5 total. And most of those have been in high risk groups.
Gotcha.
Meaning older age or immunocompromised. And so just to say, well, it's not completely out of the realm of possibility. If we have a big outbreak here locally, are we going to have impact beyond that high risk group or beyond our older age population? And the answer is, well, yes.
Because your resources are going to shrink up.
You're right.
Right.
And then the implications are, it's not just deaths from COVID-19, it's deaths from heart attacks because you can't get in.
Right.
It's deaths from suicides because people are
Locked
stressed
up in the house,
and isolated. And I get the corollary is to say, well, too strong of a public health response with this is going to have negative implications. I get that. But at the same time, we're not making you or requiring you to wear a mask isn't going to kill you.
Right.
And the masking recommendations from the CDC are logical, right? They're ages 2 and up. And I know that and you shouldn't wear a mask if you can't remove it on your own. And you shouldn't wear a mask if you're having active difficulty breathing. And my answer there is then, if you feel like you're having difficulty breathing, don't go to a public place.
Right.
Right?
Yeah.
Because if you're having active difficulty breathing, either you should stay home or you should go get medical help if you need it.
Mm-hmm.
So that doesn't mean that because you're feeling a little winded after you have walk a flight of stairs that you should take off your mask and say, well, I don't have to wear my mask because I'm having difficulty breathing. Then you should just consider whether you need to be out in public.
Makes sense. Definitely makes sense. Man, yeah, it's heartbreaking seeing the people that just get so bent out of shape about it one way or the other. Even the people that are for wearing the mask, but damn it, if you're not wearing that mask,
Yeah.
come on now, I think that I think everybody should have the choice essentially to do what they want, and you're gonna have people that aren't gonna wear them ever, and I mean, in my opinion, I think that's fine.
Well, and I'm open to you having that opinion. I would say that part of the purpose about public health
Mm-hmm.
and the part of the purpose about masking that's required in public areas, that's both an advisement of our health department and an order of the governor, is where does your individual right end when your right to not wear a mask adversely affects the safety of someone else?
Right. Especially you.
Yes.
Yeah. I mean, essentially.
And
yeah.
and I think that my answer is to say, well, it's logical to require face masks. We went through this. It took us how many years? 30, 50 years before we did something about secondhand smoke inside public places.
Mm-hmm.
But if anybody wants to look back on the history, I think it was around 1976 or 1977 when I was born in 1976 that the Surgeon General identified that secondhand smoke kills people. But it was not until around 2016 where finally we had a smoke-free indoor air law in the state of Indiana. Mm-hmm. So, well, it took us so long to respond to something that we knew was killing people. I hope it doesn't take us 40 years to respond to this situation. And it shouldn't, and it hasn't. And that's why, our governor and several governors across the nation have responded appropriately. And so, if you're in a public place, is it inconvenient for you to wear a mask? Sure. Could it save someone's life? Could it save someone's, from going to the hospital? Yes. And it's not like, okay, well, you infect me.
Mm-hmm.
Maybe that's not big of a deal. But you infect me, I infect my grandma, and she dies.
Right.
You're never going to know that,
Yeah.
right? But it's logical to say, well, that we could have stopped that. And it's all about that replication rate of the disease that R naught, which is from how they're terming this from a scientific point of view. If we can bring that replication rate and how many people one person infects, if we decrease that significantly, well, then this disease fizzles out. And we know that there have been many places across the world that have done that successfully. Does it mean they're out of the woods? No. Does it mean they have to maintain it? Yes. Does it mean that it gives them more time to develop a vaccine, get it distributed, and protect more of their population? Yes. So I know that, when we talked very first time, or early March, I think, and, the estimates were to say that a complete unmitigated disaster in the United States would have, 900,000 to 1.1 million deaths. Well, how long is this going on? Because we're at about 1,000 deaths a day. That no one said that this was going to happen all at once.
Right.
And I'm not saying we're going to get to that, partly because this isn't completely unmitigated. We've responded to it. We're developing treatments. We've got to continue to slow the spread. We've got to continue to educate, and we've got to continue to work on treatment options and vaccination options, which are in process.
Yeah. So I guess moving forward, how long do you see this playing out? I mean, is this something that I know that's going to be kind of an open and speculative question, but
Yeah, so, well, I was pretty hopeful that the summertime would be significantly more quiet than it has been. Like, if you would have asked me, I would have guessed that June, July, and August would be pretty quiet. We'd see an uptick as we got back into schools, and then October, November, December would be pretty dicey. And and the answer is that I think July has been pretty dicey for many areas of the country, especially Florida, Texas, California, other states. I know that Florida and California both have had 2 record amounts of deaths per day in a row over the last 2 days as of today.
oh, really?
Yes, and well, I mean that's just part of the 1,000 deaths that are in the United States every day. And so we know that that's happening, although we're all getting tired of it, and even the media is like, well, it's just another 1,000 deaths. So now we'll announce it when we get to 130,000, then 140,000, and 150,000, right? That's when they bring it up again.
Right.
But, well, that's 10,000 deaths between there, and it's about 10 days. And so if you're paying attention to this, well, then what's our next milestone that we'll mark, right? Is it 175? Are we going to start paying attention every 25,000 deaths because we're getting tired of it? Well, that's 25 days from now, probably, right? You mark it. I would bet probably before the end of the month, we're probably going to be close to around 175,000 deaths. And if I'm wrong by 5,000, I don't care, right? If we're at 170, 180, it doesn't matter. We still need to respond better. So how long is this going to be around? I'm looking forward to June of next year. It'll be my son's first year in 4-H. I want real 4-H, not mini 4-H. I want to have a better 4-H fair. I I want it to be better. I think that we will probably have some, at least semi-functional vaccine with reasonably wide distribution by next summer.
Oh, you think?
Yeah, I think so,
Yeah.
and I could be wrong.
Mm-hmm.
Now there is some speculation, from Dr. Fauci and other leaders at the National Institutes of Health to say that they think that we may have we have several strong vaccine candidates now. They think that there may be something as soon as, November or December of this year, and I would say, well, that's possible, but then it still has additional testing to go through, safety testing. Is what percent efficacy is it going to be? How long is it going to take them to get 300 million doses and to get them distributed?
That's
Right?
got to be the longest part, right?
Right.
Is distribution and
And
probably,
creation. Right.
yeah.
And then safety control, right? And so, do I want to be the first person to get a COVID-19 vaccine? No, I don't.
Probably not, right?
Right?
Yeah.
Well, I don't. I'd be interested in learning more about it.
Mm-hmm.
And I would say anybody who just thinks that, well, my doctor just is drinking the Kool-Aid and gives me a vaccine, I would say, well, at least personally, any medicine I prescribe, any vaccine that I recommend, it is not a thoughtless endeavor. There is risk with this. It's a conscious decision on our part for every therapeutic recommendation that we make. And so, well, I certainly want to know a lot more about any vaccine before I make it available for the public as a whole in Fountain and Warren County.
Is that something that'll have to go through like FDA regulations and all that
Yes.
as well? Yeah.
Yep.
So they'll have to. I mean, and I don't know what kind of time does that take, even get
Well,
things regulated and
without a doubt, this process will be streamlined. It is a priority, not just of the presidents. It's the priority of the FDA. It's a priority of the National Institutes of Health, and it's a priority not only in the United States but in every well, in most countries in the world, right?
right.
And so my feeling is that will we will we have ownership of the best vaccine? I don't know, right? Will it come from the United States? I don't know, but I would say that that's why cooperative efforts are so important, because we may not come up with the best answer first.
Well, yeah, that makes sense too. So, and I know we talked about this a little bit prior, but I'm sure that it's going to be in the comments. People are going to ask about, the video that's been recirculating around with the panel of the doctors there, and I believe they are from the NIH. I'm not sure which the National Institute of Health, but they were talking about hydroxychloroquine, and I know we've talked about that before on previous podcasts, but hydroxychloroquine and then zinc being used, and they were saying to use like one tablet, I think one tablet a week or something like that, and they were saying that there was really no downside to do that. In fact, they were using it as like a preventative, even for them working with other patients that have been exposed and people that were sick with it, as well as patients that have it. And they were saying that the doctor that I'm referring to, she had said that she had treated, I want to say it was like 350 patients with hydroxychloroquine and zinc, and no one had died. So I mean, I guess what do you
Yeah.
have to say to that?
So, the current recommendations and what I support is that any use of hydroxychloroquine should be in the form of a scientific study
Mm-hmm.
if it's being utilized for COVID-19. Now, we use hydroxychloroquine for lupus or rheumatoid arthritis or otherwise, right? So if you're taking it for that purpose, fine. Um, any doctor, no matter how smart they are, if they said, well, I treated so and so, 350 people with hydroxychloroquine and none of them died or none of them got side effects with hydroxychloroquine, I would say that's fine. That's your opinion. It is not the way we conduct science. And scientific studies should be done ideally in what we call a randomized controlled trial. Now, if this doctor said, well, I had 350 people who were pretty healthy. I gave them hydroxychloroquine at this dose, and 350 people, and I did not give them anything. And I randomly assigned them to those two groups. And then I compared the outcomes of them. And this is what happened. And I was blinded from the allocation and treatment groups, meaning that I didn't know exactly who got what treatment or whatever, but then I evaluated every person at the end and said, that's an appropriate study. You could potentially draw some conclusions from that. There are not good randomized controlled trials currently that support the use of hydroxychloroquine for treatment or for prophylaxis, which is prevention of COVID-19. There are some medications that are supported by scientific studies in terms of treatment. There's support for some use of dexamethasone, which is a steroid. There's some support for some use of remdesivir, which is a medication that I'm not too familiar with. And there's likely other treatment protocols, but this continued focus on hydroxychloroquine is as prophylaxis or treatment is misguided. That doesn't mean that we shouldn't continue to study and evaluate it, but it never was. It never had good evidence. It still doesn't, and it is not without its risks. And those risks are not only for people who take it, which I mean, you can look up the risks of hydroxychloroquine as well as I can, but hydroxy. Well, I don't even know that I know my phone's attached to your Wi-Fi, but it's not picking up right now. But I would say that we know that this medication is an immune modulator. It weakens your immune system in some respects, which is why we use it for autoimmune conditions like rheumatoid arthritis and lupus. There is some logic that it can help. There are some in vitro studies, which means in a test tube studies, that show that it's helpful. The in vivo studies, which means in real live people, it's not been proven to be helpful yet, and I would not prescribe it to patients, and if unless it was as a part of a scientific study or trial. And if we do and do this broadly, then people will have side effects from hydroxychloroquine, and hydroxychloroquine will be less available for people who need it where we know it's helpful, for certain medical conditions that they have significant benefit from it. And, this idea that, well, you can take one tablet of a hydroxychloroquine a week and be safe. Well, that's fairly placebo-based dosing, right? So you could take a tablet of sugar a week and be safe. And I could have told you to do that since March, and you'll say, boy, Dr. Sharma, you're brilliant. I haven't died, and I haven't gotten COVID-19. That doesn't mean it works.
Right. That makes sense. Yeah, I think that I think right now that what seems to be most important is studying it, figuring out ways to move forward that will bring real results. That way there's no, because just like with everything else, it's beginning to get so divisive, and that's not good for anybody's health either. If you're sitting up at night and all you can think about are these damn people that are doing this and they're not doing that, and and I mean, man, I feel bad for those people. I feel bad for the people that think that way, and any way that I could see to bring people together, I am for it. And until we start thinking, as a country, start thinking of things as a whole, I think that we're going to continue to face these types of issues, no matter what they are, no matter if it's COVID or or masks or whatever. And I know another big one too is like the debate on bringing kids back to school.
Yeah.
I mean, what kind of evidence is there on that?
So I will comment. I normally don't read the comments on the computer at all, but hi, Shirley. It's nice. Thanks for your message. And so, schools, I think we are still in a situation in Fountain and Warren County where we can have schools in person. I think that's most effective for education and the necessary social development of kids. I I appreciate all of the efforts that the school administrators have done recently. I appreciate the efforts that the school boards have made to approve and vet plans put forth by the administrators. And certainly, I appreciate all the efforts of the school nurses that are ongoing, especially over the next couple of weeks before school gets started. Um, I I think it's important for us to realize that school's going to be a challenge, and it's got to start at home before Johnny or Susie leaves home that morning. And I know that there's just this idea that I got to get to work. Let's pop some Tylenol in them and send them off to school, and maybe they'll get through the day.
Mm-hmm.
That's just not going to cut it this year, right? And if your child's sick, if you're not sure if they're sick, they probably need to stay at home, right? So if they got a runny nose, a little bit of sore throat, they're just feeling very mildly under the weather, keep them home for a day or two, right? If it all goes away,
Right.
send them back. If they have a fever, over 100.4 is the cutoff that's official for COVID-19, although most schools would say if your fever's over 100, then you need to stay home. And this isn't just staying home until your fever's gone. For right now, we would consider fever, cough, and shortness of breath as probable COVID. And probable is a purposeful word. It's slightly different than suspected or possible. Probable COVID means you should be out for 10 days. And you should be out for 10 days at a minimum. And if you get tested for COVID and it's positive, you should be out for 10 days from the date that you were sick. If you get tested for COVID and it's negative, you should be out for 10 days from the day that you're sick. There is not a testing strategy. This is not my opinion. This is guidance from the State Department of Health. That this is guidance that the CDC is also using, and that many businesses and organizations have been using through the summer to successfully keep functioning. If you're symptomatic with probable COVID, and I'm going to say probable COVID means fever, cough, shortness of breath, you're out for 10 days from the onset of symptoms, and you can return after 10 days so long as you're fever free for at least 24 hours, and so long as your symptoms have improved, and that's regardless of testing. Testing is still helpful, but testing doesn't change what you do. If you're out with really mild symptoms, I don't know, you've got a stomach ache, you've got some vomiting or diarrhea. Could that be COVID? It could be. If it all goes away in 24 to 48 hours, then go back to school, follow the appropriate recommendations and everything else. And and part of it is to make sure everybody knows the response that will happen. And this isn't us making it up. This is us working with the schools based on guidance that's driven by evidence, is to say if we have one probable or confirmed COVID, then even with masking, even with all the efforts that the schools are making, that with one case, the students seated around that student in class, they're out of school for 14 days. The quarantine period, that means when you isolate yourself at home after exposure, is for 14 days. The isolation period for when you're sick is 10 days. And there's a difference there. And I know that it's illogical in a way, unless you really think it out, is that if you've been exposed, you will not necessarily become infected or symptomatic right away.
Oh, it'll take the 4 days.
It could take yeah, 4 to 11 days
Oh,
is the thought, and so then you have to allow that time plus a little bit of time extra, so when you're not contagious anymore, in case you happen to be infected and contagious but asymptomatic, and so it's 14 days for exposure,
hmm,
and so if you have a probable or confirmed COVID in the class, it's all the students around. If you have two in that class, the whole class is out
wow.
for 14
Is
days.
that the current plan? Like, is
Yes,
that's what they're?
that is. And it's available on the State Department of Health website. These are not private documents. They're available for all your school administrators and your teachers and you if you want to take a look at them.
Mhm.
Similar for school buses.
So
One student, quarantine the ones around them. Two students, the entire bus is quarantined.
wow.
Different for uh, uh, ancillary activities like um, band, athletics. One student, the entire team is quarantined. It's not two, one. Now, if you plan your practices appropriately and say you've got an A team and a B team, and you cohort those, separate them, have, working on separate ends of the court, and you don't intermingle, right? You say, okay, well, these are almost two different mini teams. Then you get one person infected in the A team. Well, then the A team's out,
Uh-huh.
right? But the B team can keep playing. Um, and then and the reason those are at a lower threshold for quarantining the whole group is because, well, you're typically not wearing a mask while you're playing in the band or doing athletics, and you have not consistent social distancing, and because athletics is less of a priority than our academics.
Right.
And so I would say people, parents, students, teachers, administrators need to be prepared. I think we should all be on the same page that this is how the response is going to be. Um, and it's already happened. It's already happened in the Bi-County area. Some people may be aware or not aware, but there was a group at one school that had an exposure, and they're out for 14 days. And that happened, thankfully, because of the administrators' um, appropriate and aggressive response to that. It happened even before the health department was much involved.
So, as of, I guess, with the kids going back to school, are they all going to be required to wear masks then during school, as well as the staff? Or
Yeah.
how does that work?
So the governor's order does extend to schools. I'm gonna mainly say what my advisement is, which is consistent with the governor's order. That all students, K through 12, and staff at the schools should wear masks when transporting on public transportation to schools, when arriving and walking within schools, and when moving between classes. Masks may be doffed or taken off when students are in assigned seats that are socially distanced and that are unidirectional facing. But then if the student gets back up and moves around the classroom, that the student should remask. Teachers may consider doffing or taking off their masks while instructing at the front of the room at appropriately social distanced measures, partly because I think that facial communication, that talking to larger groups is important. But then as they're going around and giving individual instruction or walking around students' desks, they should wear a face mask. There are going to be some exceptions for masking for, again, individuals who cannot remove the mask on their own. I'll say again that if you're having active trouble breathing, you probably shouldn't be going to school.
Right.
So I don't think that that's a reasonable exemption for the school, unless for whatever reason you have asthma and you happen to be at school and are having an asthma attack,
Hmm.
you probably need to leave. You need to go get medical care. And yes, your mask can be off during that time. Um, but just because you have asthma doesn't mean that you shouldn't wear a mask. If you're having an asthma attack, you shouldn't be at school, and you can be allowed to demask while at school if your attack was happened while you're at school. And then there are going to be some um, developmentally challenged individuals who maybe cognitively or based on neurologic issues are not able to tolerate wearing a mask. There is some risk with that. But at the same time, I think that we need to be able to accommodate those exceptions, and the schools are going to work with those individuals and families one on one. And that doesn't mean just because your kid's a little sensitive that they don't like the mask around their ears. Well, then find a way to use a different device to secure it to them, right? This isn't meant for small sensitivities. This is meant for like exceptions for significant developmental issues.
Do you think that it'll be pretty well enforced? Do you think that the students as well as the staff will follow that?
I
I mean, I know that's.
Yeah, my feeling is that um it's in their own best interest too,
Hmm.
if they really believe in educating the kids and keeping school in person and um and protecting the health and well-being of the students. And my feeling is that the teachers and the administrators believe that, and um and that they will. I have faith that this will happen. We had a lower risk environment with the Warren County Fair earlier this year because it was sort of outside or in an open air coliseum with a roof on it, but it was mandatory masking there, and I would say we probably had about 98 98% compliance. And for 4-Hers that were in the ring actively working with their animals, it was 100% compliance. And if we can do it there, we can do it in schools. Um, Kids are adaptable. Kids are more adaptable than adults.
Hmm.
Um, you're going to have more than one masks. Just like I would say maybe the mask is going to be the new things that everybody personalizes, right? They'll put bling on them, or I
Right.
don't know, rhinestones on them, or different things, and it'll just be something that they accommodate to, and some will probably like it, right? I've surprisingly gotten used to having all of my patient interactions for lots of new people that I meet with a shield and a mask. And it's challenging, but it's better now than it was because I'm more used to it. That's not
Right.
saying all my patients are used to it because they don't do it all the time.
Right.
But I'm a little bit more used to it. It's not ideal in terms of patient care or my comfort, but it is balancing and saying that, well, it's not about me.
Yeah. It is weird to see, just seeing things change as fast as they are when you're talking about people being adaptable. Like I was watching a movie the other day, and there's two people in a bar, and they hugged, and you're like, oh shit, whoa, dog, careful, But now it's just like it's so foreign,
Right, right, right.
right? And thinking about that,
No, we'll be walking on a trail, like I don't know, one of the nichest properties locally, and one of my 5-year-olds who's very aware, not like, but he always just points out things. He goes, "Oh, there's those people coming. We better keep our distance, right, Da?"
yeah,
Like,
right,
yeah, and it's not like he's going like this to them or
yeah,
anything, but he's just like, giving them space
it's
and
just
giving us
normal to
space.
him,
Yeah,
right? It's so weird to see it, and it's so fast.
right,
It's so fast. Like this, if you'd have told me last year, like this is what's gonna,
right.
what? Nah. Yeah, and it's very odd to see it play out as fast as it has. But so what about so next on the thing that we got is testing. What
Okay. So, testing. I think it's important. Uh, the health department is still encouraging anybody in the Fountain and Warren County area who wants to get tested to request testing at fwhealth.org. That's not to say that you must get tested at the health department.
Mm-hmm.
That's not to say that we can accommodate everybody who wants testing at the health department. We have 2 nurses for 25,000 people. That's not going to happen,
Right.
right? However, us having a central point where people will register for testing at fwhealth.org allows us to see patterns before the test results come in. And it's seeing patterns probably a week to 10 days before test results come in. And that's useful. That's useful for us to respond and understand
Like if you get a
what's
spike
happening.
in testing.
You're right. Yes, and it's happened. It happened just over the past 2 or 3 weeks, and some information that I shared with local leaders or otherwise, some people thought that was useful. Some people thought that that's irrelevant. But I would say that we saw this spike occur in test requests. And then for those of you who have been paying attention to those cases in Fountain County that went from 30 to 60, nearly 60 within such a short period of time, which is about, 10 days.
Later, after that?
Yes, it all happened after we saw that increase in testing. The other thing that's helpful is that, as part of our test request form, we put, where do you work? Then we can have information and we can find and say, well, we've got X number of test requests from this organization or this business. And then we will reach out to that business and say, hey, is there anything going on? Or you guys, what are you doing with masking? Do you have the right signage? Have you guys noticed something, having more absences? That's not to say that you must go to fwhealth.org, but it helps us respond more appropriately. You're welcome to get your testing done anywhere. That's your right. We don't have the capability of accommodating probably every single test at the health department, but we are in the midst of trying to ramp up that service line through our health department. The State Department of Health still has those free testing for anybody in the state of Indiana through lhi.care. Our closest location for most people in the Bi-County area right now is in Lafayette, and you can register online. It's for anybody who wants a test. You don't have to be exposed. You don't have to be symptomatic. You don't have to be, anything. You can go to lhi.care and register for testing. Now, the negatives of that is right now, you can't get in on the same day for testing. Sometimes that's testing scheduling 4 to 5 days out, and the test turnaround time is 48, 72, 96 hours. And so, well, that's less useful.
Right.
But it is. I will say that the testing that's done at the health department here in Attica is free as well. It's funded through the State Department of Health, and our testing turnaround time is 24 to 48 hours.
Really?
And so, just to say that this is happening, and I'm going to emphasize this not only for the listeners, but also the leaders out there, to say that testing is not equal to treatment. We said this earlier, that
right,
regardless of your testing results, if you've been exposed and you're considered exposed to confirmed COVID, then you should quarantine for 14 days and consider testing. If you've been exposed and are asymptomatic, it is completely illogical to get tested on the afternoon after you were exposed, because you're not going to have much virus circulating in your body. If you've been exposed and you're concerned about it and want to get tested, you should potentially get tested on day 4, 5, 6. That's probably the most logical time to get tested, even if you're asymptomatic. Or you should get tested at as close to the onset of symptoms as possible, because that's when the testing is most useful and most accurate.
Gotcha. That was the
So,
question I had,
so I think that that's critical for everybody to understand. Test at the onset of symptoms or 4 to 6 days after exposure. Testing, probably starting in September, will be offered daily at the Fountain and Warren County Health Department. This is the plan. It will be offered daily, including some testing that will be offered on Saturday morning, and there will be some testing that will be offered on after hours, so from 4 to 6 during the week. But testing must be scheduled, and testing must be requested online at fwhealth.org. And we've got a lot of work to do in the next month to make sure that we have the staff, that we have the resources and the setup to not only do testing in September, but to do testing in January. And we are going to be, we do have a commitment from the State Department of Health to support us with funding and testing supplies and testing courier or transport of those testing. Because right now we have testing on Monday, Wednesday, Friday that's going on, but has to be scheduled. So go to fwhealth.org. And we have to have one of our staff members drive the testing up to Indianapolis and back every day. Well, we only have so many staff, right? And that's 3 hours out of the day that one of them's gone just transporting tests up there. So we are going to be asking for commissioner approval within the next week to 2 weeks to hire part-time staff. Part of this part-time staff will be part-time as needed staff depending on test volumes and test requests. And this is going to be probably 5 individuals who are at least high school graduates and 5 individuals that are at least LPN nursing or beyond in terms of their education, their training, and to be additional buffers for our department. Like I said, we only have 2 nurses. What if one or both of our nurses gets COVID-19?
Right.
What if they get high risk exposure? Well, they're out for 2 weeks. Right. Can I have my septic inspector go do a COVID test on you? Actually, there are rules say that we can if we train them appropriately and they have medical oversight. But my feeling is that we have to be prepared that we are going to get exposed. And I'm going to get a little bit in the thank yous first. Sorry that I can talk a lot, but our nurses, Lacey and Melissa, for those of you who don't know, right, if you're having to go 3 days a week and, shove a swab in people's nose and have them cough on you or at you or otherwise, and they're individuals who probably or maybe don't have COVID-19, I'd say that's stressful.
Sure.
Right? That's high risk.
Absolutely.
And we're doing this in the parking lot of the Fountain Warren County Health Department. So kudos to them. Thank you to their families. This does not come without a cost to them emotionally and physically. So realize this, that as we get emails from different individuals that are potentially undermining the efforts that we're doing, I would say that, well, we're doing the best we can. I do think that the Fountain Warren County Health Department has done an excellent job. I should be exceptionally careful with stating this, but I would say that, well, Warren County currently has the lowest case rate, number of cases, not case rate, number of cases in the state of Indiana. We've been at 19. And I would say that that's without a doubt partly because of the efforts of the Fountain and Warren County Health Department. That's partly because of the population of Warren County following recommendations and guidelines. And I would say that's not to, disparage Fountain County. Fountain County has, I think, as of this morning, 58 cases. It may be 59 or more now. But I would say, well, that's about the same amount as Benton County, and Fountain County is twice the size. So
good job. Yeah.
Right. So my feeling is, good job with Fountain County, good job with Warren County, but we can't lose focus. We've got to keep our eyes on the prize. And that includes if you're going on vacation, that includes if you're going to the grocery store, if you're going to work. We've got to be consistently focusing on this. And if we don't, that's when things will unravel. So if you get tested in Illinois right now, please let us know. Let us know your results so we can put it in the state database so we can make sure that the state hopefully reaches out to you for contact tracing. If you can't get a hold of the health department, email us. I would say that I know that we have volunteers and staff who are answering phones. You can chat with us on our website. I do know that our Facebook site has been really impossible to access. And I think that we were unfortunately very successful at getting a lot of people who were tied into our Facebook site. And once we reached a certain threshold of people who followed our Facebook site, then there's more restrictions, and we have been locked out for 2 to 3 weeks. We are still working on this. And so if you wonder why we've not been doing anything on social media or Facebook, it's because we've been, well, really busy with other things, but we've also been locked out. So I think we're in the midst of getting a new Facebook, which is going to be at FW Health DEPT. And so my feeling is, well, stay tuned for that. We're trying to put stuff in the papers, and we've been working a lot on just numerous other things. So testing, you can also have it done at a local hospital. If you're really sick, go to the emergency room. If you're concerned you have COVID, again, notify them as you arrive. Maybe arrive masked would be even better. But if you don't arrive masked, then notify the staff immediately upon entry so they can protect themselves. If you call 911 and you're concerned about having COVID, right, and your ambulance crew is coming, they should be coming with masks and a face shield, regardless of if you have a heart attack, heat stroke, or if you have a broken hip. But if you have COVID, they should take additional precautions, it's best for them to know as soon as they can. And this guy, I was an EMT when I was 18. I took the training, did my certification and everything, drove ambulances for Warren County. When I was younger, got in an accident once in a McDonald's parking lot.
Slick work.
It wasn't an emergency, but it wasn't a bad accident, and it buffed off, so I was okay.
I had a buff.
But I would say that assess the scene safety. It's first responder, it's emergency response 101, right? You're not going to go into a scene that's unsafe and potentially expose you or expose someone else, even if you can save a life, because you're going to create more of a mess. Right? So if the scene's not safe, secure the scene first.
Yeah. One question I did have on the testing. What exactly, for the folks that are listening that don't know, what is the test? So you go in, you get a swab up the nose. From what I've heard, I've never been tested for it, but I've heard that it's rather intrusive. Like
so it's evolving.
Kind of
it's evolving a little bit. So earlier in the testing, it was what we call a posterior nasopharyngeal swab. So it'd feel like it's really going into your brain, because it has to go through the bony opening of the nose, not just into the anterior or the front part of your nose or your nair. It has to go through the choanal opening to the posterior nasopharynx. So you can look up all those terms on Google and sort of see where it goes. But it really does feel like it's probably going into your brain, although I've not had it done either.
Yeah.
There is still some testing, and I still think that quality of testing, that specimen collection is still the gold standard. Some of the sites have moved to anterior nasopharyngeal swabs, which are easier, less painful, and I think the problem with those is that we do know that the sensitivity, meaning the amount of false negatives on those tests, is higher.
Oh, yeah.
And so it comes as a cost. And I don't know the it's not a huge difference, but it is some difference, and testing needs to be as accurate as possible. And so, uh, if you're getting a different testing protocol and you're getting tested a second time, feel free to ask, and someone should know that, oh, we're doing this now, or otherwise.
So the ones that you guys do are the
Right now, the Fountain Warren County Health Department is still doing the posterior nasopharyngeal swab, so the more intrusive one, which it's a small swab that's got to go far back in the nose. It shouldn't cause bleeding, but it could cause bleeding. I don't, normally,
does that hurt?
normally it does not. It is a little uncomfortable.
Yeah.
Uh, Again, well, I hate to say that because I haven't had it done.
Uh-huh.
So my feeling is I'm just going to say it's uncomfortable. It depends on how you process it.
Yeah.
And it can make you ache and can make you you'll feel it not even after the test is done.
Really? Wow.
So I would say, well, yeah, it's not a lot of fun. We're not saying you must get tested. Testing is still your choice.
Yeah.
But testing does help us to follow the spread of the disease. And so, and it can give you information too. But again, if you're sick and you're waiting on your test, consider yourself positive. If you're exposed and you're waiting on your test, consider yourself positive. Even if your test comes back negative, it shouldn't change what you do. You still have the 10 to 14 day isolation or quarantine period. And I get that that's, then people say, well, why the heck get tested anyways? Well, because it gives us information,
Mm-hmm.
and it can give you information, and it can help us contact trace more effectively and respond to the disease so we can hopefully squash it.
Yeah. A lot of people, that contact trace, it's getting rather sophisticated. My phone now will tell me if I've been in contact.
Oh, really?
Yeah, the new iOS update for iPhone users. Yeah, it's built in. Like you can turn it on, turn it off, but if there's someone that has been infected and then they put into their phone that they
Huh.
have, if they have been in contact with, with your phone, it will tell you.
Yeah.
Yes.
I think we're going to get better and better at this. I don't know that the centralized contact tracing that's done through the Indiana State Department of Health is currently utilizing cell phone data for tracking or exposure. I think they're doing it the old-fashioned way, but like you sort of described, that's more of a user-driven contact tracing,
Right.
that you can just enable yourself, and
Yeah.
maybe it sounds fine to me.
Yeah. Seems like it works better than not working.
Yep. And again, not everybody needs to know this, but if you're really curious, if you know someone who has probable or confirmed COVID, then they are considered contagious 48 hours prior to the onset of their symptoms. So, if you develop symptoms within 48 hours from now, you better let me know, right? Because then I'm gonna be,
You're gonna be pissed.
I'm gonna be, well, I'll be exposed.
I'll give you a holler. Yeah, and so like the another thing too that I wanted to bring up, people mention asymptomatic a lot. So you have no symptoms. How often? I guess how common is that?
Yeah, we think it's up to 40% of individuals who get COVID-19 are asymptomatic.
Wow,
So
regardless
that's a
of
lot.
age.
We
Is
think
that
that asymptomatic carriers are more likely younger and lower risk. Now, there is potentially some emerging evidence to say that the severity of your illness will depend on the not only depend on your risk factor, so are you older or otherwise, it'll also depend on your initial viral exposure. So if you got like 1,000 viral particles, which maybe probably isn't that much, maybe you won't get really very sick at all, or you're more likely to be asymptomatic. If you got 20,000 viral
Oh,
particles, then you're more likely to be more sick or more symptomatic and probably replicate and produce more virus and spread more. So that's part of the logic about
wow.
masks, is to say that, well, If you do have exposure, now masks, some people may say, well, that's going to complicate things because if we have even more asymptomatic people with masks, well, it may complicate things a little bit, but I would still will say then that's more people that are developing immunity and um, not getting as sick, and so probably not utilizing healthcare, and so that's great.
Mm-hmm.
So masks protect you, they protect me, and they probably help us to get less sick if we're going to get the disease in the first place.
So would you say the goal would be for a majority of the people in the country to get it,
Oh, so
to develop an immunity to
yeah,
it?
yeah. So I think that our only way out of this probably is herd immunity, either through a vaccination or through disease exposure, and to say that, uh, well, if we look at it and we say that we've got 150,000 deaths, and we've had probably 2 to 3% of the United States that have been exposed or contracted this disease.
Is that about what
Yes,
it is?
that's
Yeah.
about where we're at. Um, then and those numbers aren't adding up quite exactly, because if you say, well, we've only had 3 million positive cases, I really don't even remember what the number is now, but it's a lot.
Mm-hmm.
And say, well, that's only 1%. Well, we know not everybody who's been exposed has been tested positive. So some of this is based on epidemiologic data that's based on studies that were done in Indiana by the School of Public Health and at Fairbanks at Indiana University. And to say that we think the prevalence of disease or antibody in Indiana is between 2 and 3%. That's similar nationwide. It's going to be a little bit higher in New York City, and it's going to be a little bit lower in Montana,
Right.
right? And
Right.
so, but nationwide, we have 300 and whatever, about 300 million people. We have 3 million confirmed. That's 1%. We're probably missing some people, so that's 2 or 3 times that amount. So probably 9 million people have had it, which is around 3%. And if I'm way off on my numbers, someone can scold me with this. But we've had 150,000 deaths, and that percentage of people infected to get to herd immunity. There's some suspicion that some discussion that we probably need to get to 60% exposure before we get real herd immunity, at least, and potentially 70-80% exposure before we get enough herd immunity. So are we realistically going to be able to tolerate getting there by people getting infected? Well, it's certainly not been very easy, and we have 3% getting infected. If we have to keep on going through this at this rate, so 3% all the way to 70%, it's going to take us
That's
a long time.
What would that look like? I mean, would that be a pretty linear line, or do you think that that would slope up?
Oh no, it would be sort of these peaks and valleys,
Yeah. Okay.
which is what we're going through now, right? So,
Right.
and part of it depends on, well, it's going to be peaks and valleys. So we peaked in April, people took it seriously, got better. We peaked again in July. Some places are trending down now. It'll get better. People will get tired again and sort of loosen up their things, and then it'll get worse again.
Uh-huh.
And so, well, that's if if you go back to that, I think that Royal College of London paper that I had, I don't know if I had talked about it too much, but in one of our, I think it was our second discussion, well, all those graphs showed these little peaks and bubbles and things like this. That, well, that's how we get through it. But that was after the big peak, and then to say, well, this is our mitigated scenario. That's probably the best we can do. And yeah, it's going to take some time. I still think that the duration of this will depend on vaccines and other treatment options, and behavior.
Yeah. Well, boy, I've had you for just over an hour now. Is there anything else that you want to? I hate to use up all your time. I know you're a busy guy.
Um, okay. So, I do want to talk about leadership.
Yep.
And
Oh yeah, yep, that's right.
leadership in a time of an emergency,
Uh huh.
it's critically important. Um, Leaders don't have to know everything, but leaders should have a team around them who supports them and that they listen to, right?
Yep.
That doesn't matter if you're leading on a local level, on a state level, or on a national level. I would say that that is critically important. Um, I don't expect our governor to know everything about public health. That's why he's got Dr. Box,
Right.
right?
Yep.
I don't expect our commissioners to know everything about public health. That's why they have a health department.
Right.
That's why they have a board of health.
Mm-hmm.
And I encourage um, leaders on all levels to engage with the support teams that are there because they're there for a reason,
Right.
right? And and if you're not going to do that, then my question is why,
Do you think
right?
that's something that's being neglected now?
I think that we don't have that happening appropriately on a federal level, and it's been less than effective on a local level as well. And we must realize that the health department will be able to reach a lot of people with our messaging.
Uh huh.
Um, but if we're not consistent and supportive of our messaging from different platforms, we're not going to be as successful. That's why this platform is so helpful, right? Because you're going to reach a different audience than I will.
Right.
Right? The schools will reach a different audience than the health department will.
Yeah.
And the grocery stores will reach a different audience. The newspaper will reach a different audience. And so my feeling is that it doesn't mean we all have to say precisely the same thing, but the messaging has to be consistent. And if there are questions, great. We can handle questions,
Right.
right? If there are uncertainties, great. But we cannot have people twisting themselves inside out to try to say that this is not a thing
Mm-hmm.
or it's not affecting our community because there is no public health evidence to support that. And certainly I'm not going to be quiet about something that I think is important. I do think that we're going to be more effective if we do this together. We had some success working with local school administrators to make sure that our first message to their populations was a consistent one from the health department and from the school that shows communication, coordination, and it gives certainty and some peace of mind to parents and students when they're going back to school.
Mm-hmm.
That was not uniformly accessible. It was a missed opportunity locally, and hopefully we can learn from that. I think that we've had missed opportunities here locally to have a shared and unified message. This is not political. This is not me trying to say that that anybody should be removed from office based on actions that they've taken or not taken. But my feeling is that as we move forward, we've got to realize that we are on the same team. We're not
Right.
on different teams. The other thing I would say is that there is a beauty to the leadership style that comes from the United States,
Uh-huh.
right? I mean, so we have been very successful in a lot of different areas for a reason. It's because we have a lot of self-confidence. Some people may call it arrogance. There's probably some benefit for arrogance. There's probably some benefit for bravado,
Mm-hmm.
right? There is a place for that,
Yeah.
but it is not an effective way to deal with the virus.
Yeah, like what we had spoke about before before we started this podcast. Yeah, it's a very interesting. I never even thought about that until you said it, but it is very interesting. Like when you talk about war or any type of negotiation or anything like that. If you're coming to the table and I'm gonna win because
Right.
I'm gonna win.
Right.
Like, other person's gonna probably, okay, well, there's gonna be some wiggle room there. Like what you said about the, you know, a virus doesn't care about that,
No, it doesn't.
and I think that, uh, that's a really valid point of the folks that I'm gonna do my thing and I don't care. I'll be fine. You got to be careful. I'm not the doctor. I'll let you go in on that, but I think that just coming from an innocent bystander over here, it's it's I get it. Yeah. I mean, what do you think?
Yeah, and I just think that our approach to viruses, our approach to infectious disease, um, needs to realize that it doesn't care about our attitude. It's going to do what it does because it's biologically driven or determined to be that way based on our behavior.
Right.
And so our behavior needs to alter based on what we know the virus is going to do. The virus is more predictable,
Mm-hmm.
believe it or not. And people can talk about mutations and everything else, but we can learn about the virus. And the virus isn't thinking,
Right.
it's not a sentient being and thinking how to get around us, right? And it may evolve. I don't want to people to think that I think that the virus is actively trying to find out how to get around our defenses, but that's how viruses work, right?
Essentially, they do that.
Yes, but that happens over a period of time.
Right.
We are, that's why we have such big heads and big brains, right? We can probably process that information faster. We can work as a global community to learn about the virus, learn what works and what doesn't work, and then we adapt and we change, and that's how we win.
Yeah.
And the virus, it doesn't have a big brain, and it won't be able to adapt that quickly. But then, and so if we allow ourselves to work as a group and think and respond appropriately, then we will be more successful. So,
Yeah.
I do want to give a shout out to a lot of people. I know I talked about our public health nurses previously, but Kelly, Peyton, Brianna, Jenny, Eric at the health department, our health board members. This is, I know, been at least somewhat of a challenge for you too. And thank you for your engagement and your support. We're not at the end of this yet, right? So this is certainly not maybe what everybody envisions when they sign on to help be on the public health board, but thank you for your commitment. And I'm going to give a specific shout out to two people who don't live in Fountain or Warren County, but have been so essential. And they're an example of the type of things that are going on behind the scenes that people don't know of. So Brent and Deborah, they're fourth year medical students at Indiana University. They're on the West Lafayette campus, and they're in the midst of, rotations, applying for residency programs, taking tests and everything else. And Brent had done some rounding with me at the clinic over 2 years' time, about once a month. He's a really nice guy, and he and Deborah came down and met with our health department in early March, just when all of this stuff was getting running. And we needed people that could help but work remotely. And since around March 15th, even ongoing today, every single day, every single weekday, every single weekend, if you're making a test request through fwhealth.org, that's being responded within 24 hours by Brent or Deborah.
Oh, wow.
And I get an email from them every single morning about how many test requests are coming through, where they're coming from. They're getting prioritized in terms of high priority, low priority, or no priority testing. And then that information is then going to our nurses, and it's all done electronically. It's all done behind the scenes. But that level of commitment for those two individuals who have nothing to do with Fountain or Warren County,
Right, that's a big thing. Yeah.
is inspirational. And I think it reminds us of, how important it is for us to work together. And beyond that, I can ask Brent, I'll email him and say, and we've got this set up so that he looks for patterns anyways, and he'll put it down in the email that we've seen this many from this business in the last few days. We have a new one from this business, and we hadn't seen any more from this business, and for 2 weeks. And then the other day I was going to have a board meeting, and so I said, hey, can you run some of those numbers, put them in a graph, and send it to me? This is happening, right? I cannot do this myself. The health department can't do this themselves. The community has to work together. This takes volunteers, it takes commitment, it takes care, and it takes patience. And no one's saying that we're getting it exactly right, right? That's not my statement, but we're sure working hard at it. So Brent and Deborah, thank you, not only from myself, but from everybody in Fountain and Warren County. I know you're probably never going to listen to this, but it's you're an example of what's going right.
Well, it's always a pleasure to have you here. I'm glad that you made time, and I'm always down to have you. So
Great.
with all that, I do want to thank the sponsors. So you guys can win some of these super slick gas cards here. Whole bunch of them to give away. All you have to do is like the Nanny's Convenience Store Facebook page, and you will automatically be entered to win. It's in the description of this video. And actually next, I don't think I'm supposed to be talking about this, but I'm going to spill the beans anyways. I'm actually giving away a Yeti cooler. There will be more information on that soon, but that is next on the giveaways. And Parabellum Firearms and Range, thank you guys as always for sponsoring and hooking me up with all the cool stuff. You can't ever go wrong shooting guns and stuff. It's just it's the greatest thing ever. I love it. So sign me up. And Grady,
So long as you're doing it safely.
oh,
Right?
oh
Right?
yeah, safe. Safety is number one. And they have a great operation too. It's an indoor range, and it's actually one of the nicer indoor ranges. I've been to a few, but it's actually one of the nicer indoor ranges I've ever been to. And then they even do they actually do courses once a month too. So you go
Okay.
beyond the threshold there of where you would typically shoot and run your targets back and forth. They'll set up basically what they do is they set boards up, and then so they sit like they're on the ground, and you actually run through a course. You have to shoot through like a car door for one, right? It's very cool. You have to be a semi-skilled individual, and they do a lot of safety, like basically a safety briefing. You have to pass certain sections and things like that to be able to do that. But it is really cool. It's a blast. If you've never even seen it, it's fun to watch even. Like, all these guys are crazy. But lastly is Grady Funeral Homes. They've been a podcast sponsor since I believe like day one, and I greatly appreciate that. So Mike Grady, you're an all-star, brother. I appreciate it, and thank you as always. And the health department, you guys have done an amazing job at doing everything you can and keeping people together and keeping the information going the best that you can.
I got one more thing. Remember that travel advisory that was out there since early July to say if you're planning on attending in-person school at one of the Bi-County schools, we recommend you for the 14 days prior to school to limit your travel to necessary and emergency travel only if you're going outside the Bi-County area. This will give us the best chance to get into school and stay in school. Right. And believe it or not, we're right at that 14-day period before school starts now. So if you got vacation planned, it's your choice about whether you keep them or not. I recommend you have a 14-day quarantine period in the Bi-County area upon returning. And the logic of that is because we know that travel by itself is a risk. So think about that. I'm not going to come and police the county borders or anything like this. It's not our job to do that, and we couldn't do it. But we have one chance to get school going right. This is part of it. And so, just think about what you do over those next couple of weeks before you get in school.
Great message. Well, I thank you for being here, and I thank everyone for listening, and I will see y'all real soon.